Hi, I'm Dr. Mary Shackleton, naturopathic doctor, and I'm here today with Dr. Debbie Hamilton, who's a pediatrician. She's the founder of Holistic Pediatric Consulting, and she's written a book on preventing autism and ADHD. She's actually in and on the front lines of working with women before they get pregnant to prevent having a child with a neurodevelopmental disorder. And I am so glad that you could be here today. I have so many questions for you.
Well, thank you for inviting me.
Debbie is also on the board of the Neurological Health Foundation, which is an organization that's also aimed at preventing and educating women about lowering their risk for having children with ADHD and autism. So how did you end up with this specialty?
I'm a pediatrician. I take care of children with autism and ADHD in an integrative model. And I started having parents who said, okay, I have one child with autism and I want to have another child. So is there any way that I can, increase the odds for having a healthier child? And I started looking at these families and looking at the mom's history. And then I have some integrative, just well child. And I looked at kind of the kids who were healthy and the children who had chronic issues and looked at their parents and the family histories. I'm like, there is a big difference in terms of how they eat, all the exposures they have, mom's history. There's a lot more autoimmune issues, a lot of more digestive issues in these moms who have problems. Not as much awareness about diet, not as much awareness about just the products they use to clean their house or what they use for cosmetics or creams. And I started like, okay, there's got to be a connection here. So I started researching it. And that's where I came up with my book.
Okay, well, I have to say that Debbie is one in a million because most pediatricians are not integrating all of those pieces into their case intake and looking at the potential outcomes from all those factors. So it's a rare thing. And so your patients are so lucky that they get to see you with all this information that you have.
I feel like I'm fortunate because I have moms who come with questions. And I was like, that's a really good question. So I kind of try to figure things out. Mm-hmm. And treating children, you're treating families.
Right.
Moms and children and the whole families are really connected. So I feel like I learn a lot from my families too.
Mm-hmm. I feel like there's so much attention on the statistics of autism and the rising incidence, but there's not enough attention. And in my opinion, we both have masters in public health, which is a very prevention-oriented field. Yep. I never feel like there's enough attention to prevention of autism.
There hasn't been until the last few years because the rates have gone. Right now, the rates are about 1 in 50 children in the United States with autism. ADHD, so that's about 1% of children. ADHD is about 10%, 9 to 10%. And if you think about back in 1987, it was like 1 in 2,000.
Wow.
And so every 2-3 years, they kind of increase.
Wow.
And there's a lot more in boys. So maybe 1 in 38 boys was the last statistics. And people are actually predicting even worse statistics. So we definitely have an issue.
Right.
And if we don't go back and try to prevent this, we're just having escalating, just the health of our children, some of the chronic illnesses, not just autism and ADHD, but chronic allergies and asthma, a lot of depression, neurological issues,
right,
all sorts of different issues.
I even see in my practice often that the patients are sicker and sicker and sicker. So yes. No longer do I see people with just straight up PMS right. or a cough or asthma. Yeah. It's usually multiple layers of things that honestly have an underlying layer of toxicity that needs to be addressed in order for them to get well. Right. Can you speak a little bit about the spectrum of autism?
I think of autism and all the training I have in autism, it's a spectrum. People know there's Asperger's and there's high function autism. But ADHD and autism, especially in their root causes, overlap. Mm-hmm. And so a lot of kids, as you improve them from autism and they can speak better, the communication is better, you see a lot more ADHD symptoms. Mm-hmm. You still see some of the social immaturity, executive function, hyperactivity, a lot of learning issues, and a lot of sensory issues. Sensory processing is, very sensitive to sound or touch or taste or texture. So they'll only eat a few foods.
Right. So challenging for patients.
Right. And so it's kind of kids from autism go to ADHD, then go to sensory. Mm-hmm. So it really is a spectrum. And the kids with autism are definitely the more sick in terms of immune problems and digestive problems.
Uh-huh. Can you talk a little bit about the interplay with digestion and neurodevelopmental disorders?
Right, the gut-brain connection. When I wrote the book and I treat children with autism, parents are like, okay, I've got a child with autism, all these neurologic signs. Why are you focusing on their gut health? And anything that comes in the body, you have to eat and assimilate. So anything that goes in, but there's even a lot of neurotransmitters in your gut. Like there's more serotonin in your intestines. And there's a whole kind of ecosystem in our intestines that we've really disrupted from a lot of the toxicity in our diets, toxicity in our environment. And in order to kind of heal, inflammation, in order to restore your nutritional status, you have to have a digestive system that absorbs food.
I often find myself in a position to defend what I know and see clinically. And patients often want to say, is there a proven link between environmental toxins and autism? What do you think about that?
There are multiple proven links between, if you talk the span of neurodevelopmental disabilities. So we've known for years that if a mom's exposed to mercury, that her child will have neurodevelopmental disabilities. That can be autism, that can be any developmental delay, learning disorders, ADHD. The most recent studies have shown a really good link between if a mom's exposed to pesticides, mainly in foods, then her child has an increased risk of autism, ADHD.
Which is really an amazing thing to be able to prove, because a lot of people think that conventionally grown food is perfectly safe to eat.
Well, pesticides are killing bugs.
Right.
So not only are they neurotoxins, but they actually kill the good bacteria in our intestines. They kill those good bugs. So there's kind of a double effect. But a lot of that there are certain women in California who are near farms. And they say the closer they are to really high pesticide, like exposure in pregnancy, the higher rates of ADHD and autism.
That's fascinating.
So there really are some good studies, and multiple ones over the last couple of years.
I saw a Danish study. They took one family of 4, and they measured the urinary output of certain metabolites from pesticides with a normal diet. And then they ate exclusively organically for 1 week, and they assessed the urinary output again.
It clears so quickly.
It clears quickly. So that's the exciting and empowering thing for people to know. A lot of changes take a long time to put into place, but in terms of eating an organic diet, the benefits can be really rapid. They can show up very quickly.
When I started writing this book, I was like, okay, organic foods. And the more and more I read, the more I'm like, this is huge. If you think about, pesticides, they're neurotoxins, they're killing things. And this is something you're exposing a baby, a small embryo inside for months. And with a developing nervous system, developing detoxification system, developing digestive system. And how can this not be significant? But the research is really supporting it more and more. Thankfully, right?
Yes.
Yeah. We've known some of the heavy metals. We know some other environmental chemicals. There's actually studies with autism with phthalates.
Good.
There's a study with vinyl floors, which have phthalates, and women who are exposed to that have increased risk of children with autism. So they're becoming more and more. The research is getting better and better.
And generally, my feeling is also that the sicker that people get, that does drive research. Unfortunately, it's not the other way around. That we are preventative enough to say, I wonder if this vinyl flooring will be safe in my home, versus, ooh, I feel sick. I wonder what's in my home that's making me not well.
And the United States has a different way of looking at toxins than others. So in Europe,
we have to prove that it's dangerous.
We have to prove it's dangerous, where in Europe and other countries, they have to prove it's safe
before they use it.
And not only prove in the United States, it's also, a lot of things aren't studied in children and aren't studied in pregnant women, who are the most vulnerable people. So it's kind of a backwards thinking. So you can't just assume because it's there, it's safe. So a lot of the emphasis for prevention is, fortunately, now focusing on women's health. What about men? Do men play a role in the transmission of environmental toxins to the fetus? There's some good studies about maternal age and also paternal age. So the older a man is when they has a child, the increased risk of autism, ADHD, and other neurodevelopmental issues. And the older you are, the longer you have toxic exposure, and the more that you would affect your tissues. And so the nutrition of the man does matter, the toxicity matters. And I think that's an area that we really need to look at more.
How did they figure that out? How can they separate maternal from paternal?
I think they, and they do studies and they look at just different individual factors. And paternal age is consistently in more than one study that shows risk.
Interesting.
And usually 40 is the age, but sometimes I've seen 35.
Oh, wow.
So, which is the similar for advanced maternal age for...
And this isn't like, there's studies from different countries.
Okay.
So not just the United States.
Okay, thankfully.
Right.
I know that you see this too, but women will always sit down in the chair in the clinic and say, I want to get pregnant in 2 months and I want to do a detox.
Right.
So then I start to talk to them about how we bioaccumulate toxins over a lifetime.
Right.
And that we do need to put a plan in place that's longer than 2 months.
Right.
What do you experience the same thing with
I very, very much agree. It's like, oh, I want to get pregnant now. I'm like, well, if you detox, you're trying to remove environmental chemicals and, metals from your body. But if you're doing that actively, a lot of these are running through your system. If you get pregnant during that time, you actually have the risk of exposing like a very newborn baby to more chemicals. It's actually more dangerous. So you cannot detox when you're pregnant or even trying to get pregnant. And it takes a long time to, clean up your house and clean up your beauty products and improve your diet and learn how to cook, learn how to drink clean water, get those plastics away, all those things. It takes a long time.
It's a massive undertaking. And I always try to encourage patients to just do the small, most sustainable steps.
Right.
So if you try to change everything in a month, you will drive yourself crazy and you will fail.
So,
and then you won't maintain it for pregnancy.
Right.
So
yeah, so all these changes need to be kind of put in place, and then the next change. So, we've talked about eating organically. So that's probably the number one.
That's always for me. Getting your diet, always start with diet and digestion. And sometimes women come in, well, I've had chronic digestive issues for years, and oh, my thyroid's abnormal, and oh, I got period problems, and I've been on the pill for years or decades.
Right.
And that takes a long time to kind of get your body back to a healthy state.
I find even if somebody has a very uncomplicated past medical history, they're very well, but let's just say they were on antibiotics over 20 times in their childhood.
Right.
That in and of itself requires some cleanup, and that it takes much longer than a month to do that.
Right. I say 6 months to a year if you've got a year, depending on your history. Most people come in, it's like, I want to do it now.
Right.
And I think that's because women are going to school. They're starting families later.
Right.
So they're under pressure to get pregnant as soon as they can so that they miss the 40-year-old mark if they can. Right. But it's probably safer and a better idea to give yourself a year of detoxification before you conceive.
Even reducing your stress load and kind of simplifying your life makes a difference.
Right.
So yeah, like a lot of people come in and I said they're educated, they schedule like, well, I have 3 months here, so I need to get pregnant now.
Right.
So I can have a baby here when I'm in between jobs. And
right.
It's like, it doesn't work that way.
It doesn't, unfortunately. We think we can do that, but the truth is that we have to still respect and abide by the natural clock.
Yeah, and I usually try to get, their partners in there because I do think it's important to get the men to be healthier and to understand why all of a sudden, why are there all these different changes in their household? Why are you buying this different product? Why is this important?
Right.
Because this is things you want to sustain, obviously, through pregnancy. When you have young children, you want to maintain this kind of lifestyle.
Right. And teach them
as well.
Women are the major consumers of healthcare, so
right.
They're the ones that find the doctor in the first place, educate the entire family, and I do feel like they do need support because sometimes they have a partner that's not on board, and it needs to be a whole household.
Well, if there's diet changes and one person does it and the other person doesn't, they won't maintain it.
Right.
Or complain, why are you, spending this money on the food? Why is this important? Or supplements too.
Right. Supplements.
Why are you taking this?
It's a big one.
And I don't let the men off the hook either.
Good.
I'm like, they're actually prenatal or preconception men's vitamins.
Awesome. I didn't know that.
Yeah, the focus, CoQ10 and vitamin E. Zinc is really important for fertility, for both men and women. Detox, if I get a sewn-up protocol from mom's like, well, you know what? You potential dad, you have to do it too.
Right.
Clean up your water, clean up your food, clean up your environment.
Great.
Because I think we're still learning a lot.
What would you say are the top 4 or 5 exposures that you want to minimize preconception, during pregnancy?
Well, definitely the pesticides, organic foods. And don't forget what you put on your lawn. Mm-hmm. I'm like, oh, I eat organic foods, and then there's like this chemical that's all around on your lawn, or your. So you think about that, or you're not spraying bug spray in your house. So organic foods. I definitely think there's certain supplements that you have to do. Mm-hmm. Omega-3s, the DHA, vitamin D. I'm a big zinc person, so probiotics. Mm-hmm. Definitely get your gut health in talk. Clean your cosmetics. I talk about the polluting Ps, phthalates, parabens, plastics, petrochemicals, which are basically, and pesticides. So those are kind of you have to do things in in a nutshell, that's where I would go.
Great.
One of the interesting things that I talk to patients all the time about is vertical transmission. In other words, pesticides and exposure to chemicals don't just affect you from your life, but what your mother passed along to you and her mother passed along to her does have an impact on your total toxic load. So it's an interesting concept. It's a little depressing. But
it's frightening. Mm-hmm. And the whole issue of epigenetics. Do you ever talk about epigenetics?
Yep.
And I think of epigenetics as how do environmental toxins affect your genes.
Right.
And they cause changes in genes, and then those genes are passed on.
Right. We've learned so much that genes are more influenced than we used to think. We used to think you'd be born with a gene and it would be doing its job for the rest of your life. And now we know our thoughts, our lifestyle, our exposures, and our food all affect gene expression.
Right.
It's fascinating.
Well, I mean, we know cancer is basically change in gene expression. It's telling cells to basically grow.
Right.
And to not stop.
Right. There's less control over that message.
Right. And think about it. We know that there's a toxic exposure to cancer, but then we're denying that there be a toxic exposure to other chronic diseases.
Right.
That doesn't make any sense.
It doesn't make any sense. And I wonder, I know that the APA's standards for safety are inadequate to protect us.
Right.
And they're not putting standards in place that help with the safety of exposure for women, children, and all people, and adults.
Well, the EPA also studies one chemical at a time, but never in this world are we exposed to just one chemical at a time.
Right.
And so you have multiple chemicals over a lifetime.
Right.
It's like synergistic. The effects kind of keep going.
Right.
And they also don't study women, pregnant women, or children who are just, think about it, smaller in size. So the same amount of chemical that might be fine for an adult, if a child is like a quarter the size, it could be really toxic to a child.
Right.
So it's not studied in the way that we're exposed to in the real world.
Right.
Is how I see it.
Exactly. I think about the synergy of chemicals a lot. You think about women, before they leave their bathroom every day, there can be up to 200 exposures.
That's frightening.
With, conditioner, shampoo, lotion, deodorant, hair products are the worst.
Yeah, or nail polish.
Or nail
polish remover.
Right. So all of these exposures over the period of one day can be significant. Right. That's why we want to really work with patients to teach them how to live a life of detoxification. So they're slowly reducing their exposures on a daily basis, and that adds up to a really a big change in their toxic load.
Well, people don't think about what you put on your skin. Anything you put on your skin is absorbed into your body. Right. So if it's not safe to eat, you shouldn't put it on your skin.
Right. We formulate prescriptive medicines in transdermal creams.
Right, because they're absorbed. It's a good way to absorb things.
Right.
But people don't think about that.
Right.
Or things you breathe in.
Right.
So the good news is,
there is good news.
We could talk all day about how bad it is. Yeah. And there's many things we haven't touched on, but I'm always hopeful because we're learning more and more. Number one, I think our testing is becoming more sensitive, so we can measure phthalates and parabens and environmental pollutants in our what we're holding on to. We can measure that. So that didn't exist years ago, and that's super helpful. You can measure pre and post. Our heavy metals testing has improved. Our gut digestive testing is much better. I think it needs some help, but we have a lot more information on these stool tests than we ever used to have. And I think the more that these conversations happen, the more education takes place and the more awareness changes people's behavior. And that behavior change affects ultimately policy and legislation.
Right. Yeah, I agree. But I always think about hope, because if you know and understand the issue, you understand you can make changes in your diet, you can take supplements, you can test yourself, you can clean up your environment. Mm-hmm. I think the main awareness I want is that women need to know that they do need to do things before they get pregnant.
Right.
That you have to detoxify, that you have to clean up your environment, that you have to clean up your diet.
Right.
In order to protect yourself and your children,
right.
and your future children.
I think that the next generation of women will be quite different than past generations. Past generations were focused on potentially the nursery being very safe and healthy.
Right.
But cord sampling studies have shown that babies arrive at birth with over 287 chemicals, none of which have been studied. The cocktail hasn't been studied.
And chemicals that haven't been in the environment for decades.
Right. Are
still showing up. That's frightening to me.
It is.
So the good news is there's a lot of proactive things that patients can take to protect themselves and their families from having babies that are born with neurodevelopmental disorders. Thank you so much for being here today. This was so much fun. If you would like to check out Dr. Hamilton's website, it's holisticpediatricconsulting.com. And do you have any other references or resources for listeners?
Yeah, the other resource would be neurologicalhealthfoundation.org. They have the Healthy Child Guide, which has some great specifics about supplements and diet and some things about, things to avoid in the environment. So that's a very good resource also.
Well, thanks again for all your pioneering work in this field. It's super important.
Well, thank you. For you too. For all of your work and effort in this area too.
Thanks.